Good morning, everyone. I'd like to call to order the Audit Committee meeting of the City of New York on May 22nd, 2024. And first item would be, I'd like to have the secretary do a roll call.
Good morning, everyone. Our private members, Michael Spitzer, Chair. Larry
Present.
Angelo.
Present.
Mark Kaplan.
Present.
Marcia Van Wagner.
Present.
Our public members, representing Mayor Eric Adams, Paul Timas.
Present.
Representing Comptroller Brad Lander, Jacqueline Thompson.
Present.
Representing Public Advocate Jimani Williams, Wesley Paisley.
Present.
We have a quorum.
Thank you. The next item on the agenda is a motion to adopt the minutes of the Audit Committee meeting held on March 27th and April 10th of 2024.
So moved.
Okay, if anybody has any edits, please
I would like to submit a whole lot.
forward them to Katrina. The next item on the agenda is a presentation by the New York City Health and Hospital Corp. Could you please identify yourselves?
Sure. Good morning. I am David Guzman, Corporate Controller for the Health and Hospitals Corporation. I'm joined here by colleagues in my division and our colleagues from Grant Thornton. So I'm here joined by Joseph DeBroja, James Linhart, Timmy Diallo, and Tammy Radinsky to my left, and Stephen DeGuardi from Grant Thornton. You want me to proceed now? Okay, great. So we're here to present the FY23 financial statements for the Health and Hospitals Corporation. Again, I just want to take the opportunity to thank the team members that are present here and our partners, Grant Thornton, who've done an amazing job with us partnering on what's often a complex audit process, but I think we're really happy with the results here. So we'll be presenting today the statement of net position, balance sheet, statement of revenues and expenses, and changes in net position, aka the income statement, and the statement of cash flows, and notes of the financial statements. We'll focus on our presentation on the income statement, which encapsulates the system's overall financial performance in FY23. The FY23 income statement is showing a total operating revenue of $13.96 billion and a total operating expense of $13.92 billion, which yielded a small operating gain of $39.6 million. Controlling for our capital contributions, there was an improvement in net position of $565 million on the bottom line. With respect to some key trends, I'm going to turn it over to my colleague Joseph, who's going to walk us through some of the more detailed performance on the income statement.
Good morning. My name is Joseph. I'm a director of accounting.
Can you speak into the mic, please?
Good morning. My name is Joseph DeBroja. I'm the director of accounting and finance with Health and Hospitals. I will take us through the key bullet points from our income statement and the variance analysis that we've performed for year-end FY23. Our net patient service revenue increased $124 million during FY23. The biggest increase we've seen is attributed to increase in DSHMEX, disproportionate share hospital payments during FY23 of $268.3 million. The other notable increases were in the risk pool area with Metro Plus and also other non-Metro Plus risk pools that we have with other managed care plans. Appropriations, or as many of you know it as tax levy, from City of New York increased $680.9 million. The majority of this increase is due to the Humanitarian Emergency Relief and Recovery Centers program that we run on behalf of the city. And the other areas that have increased are the unrestricted subsidy and the collective bargaining that we had settlements during FY23 for. Premium revenue is really a Metro Plus item, and premium revenue has increased during FY23. for $442.6 million, and that's mostly attributed to the overall membership increase with MetroPlus. Roughly about 90,000 new members MetroPlus had during FY23. Grants revenue has decreased $1.6 billion, and that's mostly because of the decrease in GRACE grant revenue and also the FEMA CARES / ARP grant revenue. Other revenue is a smaller item. I guess it decreased $57.9 million. One of the key things in other revenue is our 340B pharmaceuticals program, and that decreased about $22 million. And our accountable care organization revenue also decreased $7.4 million. We have one item called UPL conversion, prior period revenue, in 22. However, we don't have that on our income statement for 23. Therefore, it's just a decrease of $514 million. In other words, there is no prior period UPL conversion revenue in 23. Do you have any questions on the income side, on the revenue side?
Yeah, could you just go over once again the grant revenue
Sure.
reduction and why?
Sure. So the grant revenue, obviously the FY22 was still kind of like the COVID period. Obviously, we had a lot of COVID revenue and test and trace revenue as well, because that was still ongoing. And in FY23, we obviously saw a drop or reduction in utilization of those services. So test and trace revenue decreased $993.5 million, which is substantial. And also FEMA, CARES, and ARP grant revenue decreased $451 million. In other words, we really had none of it in FY23.
And can you explain the lack of a UPL conversion? Why does that swing from year to year?
The UPL conversion took place in FY22, and that is when all the contracts were ratified with the managed care plans. It was a one-time shot, yeah. Correct, yeah.
Do you have your own audit committee?
Yes. Yes, we do.
And how are members decided upon?
I
Really don't know. It's a good question. We'll have to follow up on that.
I'll get back to Katrina on that, okay?
Does that mean you don't have it, or you?
No,
don't
we have
it?
an audit committee for sure. We actually presented the financials to them as well, but I don't know the membership, how they were appointed. That part we'll have to kind of find out.
I have a whole bunch of minor little comments and questions where the material didn't make sense to me. I don't know if you want to do it now or privately.
Well, maybe I can finish up with the expense portion of the presentation, and then we can go into the questions. Okay. So moving on from the operating revenue items, moving down to the our PS, or personal services expense, increased $144 million. It is mostly due to the DC 37 collective bargaining increases, or settlements, I should say. And the other half is due to the full-time equivalent increases of about 1,100 during FY23. OTPS expense decreased $387.8 million. And this is really kind of like the mixture of what you saw up above in the grant revenue section. So the grant revenue decreased because of test and trace and because of CARES and FEMA. And similarly down here in the OTPS, we saw a $1.3 billion decrease in OTPS for COVID and test and trace. Those programs, revenue goes down, so does the expense on the income statement side. But we did see an offset, an increase for HERC of about 407. You got to press it. Okay. Our
Can
fringe
you,
benefit.
sorry to interrupt, could you repeat what you said about the HERCs?
Okay. So during FY23, HERC was obviously a new program that we've been running on behalf of the city. We had up in the grant revenue section, it was a new item, and we had $451 million in grant revenue for HERC. Similarly, in the OTPS section down below, in the expense side, we had $408 million for HERC during FY23. So, new and expense down below, that kind of matches up. Benefits increased $83.2 million, kind of in line with the PS increases and collective bargaining settlements that we've had during FY23. Pension is calculated by the New York City Actuary's Office, and we have to report what they calculate for us on our behalf. So pension expense increased $144.6 million for FY23. And OPEB is similar. Pension, OPEB is also calculated by the City Actuary's Office, and that increased $20.7 million. Affiliation expenses increased $103.7 million, and that is due to contractual increases with our affiliates and estimated contract settlements for FY23. Depreciation expense increased $67.9 million. The increase is mostly due to EITS assignments, or our IT infrastructure, and the newly implemented governmental accounting standard for leases. Those are the major items from the operating expense and the variance. Any questions about these?
Anybody have any questions? Mark, you want to ask?
I have some of them anyhow. There's a reference to you need to reduce premium payments. That's a very, very big number. How did that happen?
That would be the Metro Plus side, right? The premium payments would
Yes.
usually make, we had to reduce premium payments.
I understand that, but it would seem to me that somebody should have known that the number you put in the first place was wrong.
I'm certain that they use actuaries for their calculations. Therefore, if they have to decrease the payments, there might have been a change in estimate of some sort. But we can certainly look into the context of it and get the answer.
It just seems like it's a big swing in some number with no explanation. Then, if I can, I'm going to move some other stuff.
What page are you on?
I'm on page 69. Then there is a reference on page 57 about, quote, certain regulatory inquiries have been made, and it doesn't indicate whether there's any reserve for that liability, and if so, how significant. It's the last full paragraph on page 57. Is there any sense of, do you have any? I leave you with that. And then there's a reference to OPEB. Are you in the same position as the city is about OPEB?
Yes,
Okay,
yes, we rely upon the actuary's calculation for
all
that.
right. That's what I thought.
As Mark is looking, what does the SBITA stand for?
Those are subscription leases for our IT, so software mostly. Software subscription leases. Yes.
You got a couple of little typos. I'll give you the page.
I hope Nicole is listening.
Singulars and plurals. The only thing I always like to point out is the official name of. Sorry, the microphone, please.
My finger got tired.
I'll take it over, Clint.
I'll change
I
fingers.
point out that the city of New York's official name is capital V, and you're consistently lowercasing it.
We will relay that message to our colleague Nicole Fleming. She
You're
she
not the only
prepares
one
our
who makes that
notes.
mistake. There is a, oh, I see that, you've done that. Then on page 16, there's a line, leases and SBITA net, and there's nothing opposite it. Is there a reason for that? It's a blank on page 16.
Okay. One second.
You see it?
One second.
Under current liabilities, second line, leases and SBITAs, net, and there's nothing there.
Oh, that's 22.
That's right. That is a fiscal year 22 balance sheet. However, we have it on a fiscal year 23 balance sheet on the previous page. So for comparative purposes, we had to include it on the FY22 side as well.
Okay. Oh, listen,
If they're, like minor,
they're very minor.
so we could just gather them and give them to the gentleman before they leave.
Yeah, you just want to share that with us, at the end of the meeting. We'll address it, and
Okay.
I can give all the explanations over to Katrina later on.
Hi, you mentioned regulatory inquiries in your discussion just now. If that wasn't it exactly, could you just re-say what it was?
No, I think the question from Mr. Kaplan was related to regulatory inquiries.
So I'll just make that then. So my question is, I'm not asking you for specifics, but is it Medicare, Medicaid type of inquiries?
They could be, right? I think that was later on in our note number 9 or 10. But I think we do have some reserves set up in those, in our net patient service revenue to net against those.
Do you have some sort of guesstimate of where that might go?
They're usually pretty consistent, and I don't think that note changes from year to year. So I think it's always included in the financials. Yeah.
I noticed the OPEB has decreased from 220 million to 27 million, then 47 million. Those are very big swings. What did it?
The OPEB has increased from 27.8 million in 22 to 48.5 in 23. And the main reason for the OPEB increase has been the change in the discount rate from 4.09 to 4.13 for FY23.
But in '21, it was $222 million. So this represents a very substantial decrease in the OPEB liability, I take it.
That's the expense side, but the liability also may have decreased. They have a lot of built-in assumptions that they have, and one of them may have been the mortality rate might have changed from 21 to 22, therefore it decreased. But we can get a real thing, specific answer to that from the actuary's report.
The regulatories, just to come back to that, do you set up an allowance for that?
We do have reserves for those liabilities set up within our third-party reimbursement, and that's covered. That's also reported under our net patient service revenue line on the income statement.
No, I'm looking more for the balance sheet.
Oh, for the balance sheet? Sure. On the balance sheet, those are captured in in the lines that say estimated third-party payer settlements. Those liabilities would be down there. And so the balance sheet is on page 15. Right, so the estimated third-party payer settlements for FY23 on a balance sheet is 52 million. And in 22, I believe it was about 90-something million. 90.4 million in 22.
Because that's the question that I think was really being asked.
Sure.
Does anybody else have any questions or comments?
One more, Mike.
Okay.
On the
Page-
page 11, I get a little confused. The total estimated cost was $180 million. But before that, it was $200 million. I mean, what's the relationship between the 200 and the 180? So much was done, but the arithmetic, I couldn't figure it out.
What paragraph is this?
It's on page 11, HS, and there's a statement that says, total estimated cost of 200 million. Then 29 million is placed in service. The total cost was estimated at 180 million. And the numbers, I couldn't figure out what happened.
Yeah. CIP. Oh, system-wide.
So, Mr. Kaplan, that's the middle paragraph, correct?
Yeah,
About the system-wide infrastructure called network refresh. That's the one you're referring to?
yes. I'm sure it's right. I just couldn't do the arithmetic.
And what's the exact questions?
Well, the overall amount was $20 million. Then the capital cost estimated 200 million. Then 33 million that's added to it, and then 20 placed in service. And then now the capital cost is 180 million. And then there's 4 million added and 70 placed. So I try to add them and subtract them, and I couldn't see how you got the 100.
Every year, the amounts are different.
I know that.
And we're talking about construction. CIP is construction in progress. So 20.3 million was put into CIP in FY23.
Okay.
But the overall project itself had an estimated cost of 200.7.
All right.
For that year.
Yeah, for that year.
Oh, that's an annual cost.
And then in the latter part of the paragraphs talks about the previous year.
So when it's all done, the estimated total cost, 160 million?
Initially. No, that was in 21.
That was in '21. That was in FY '21. The estimated cost was 160 million.
How much is, if you look at it, and how much did the whole thing cost?
Finger tired.
What?
I asked if his finger was tired.
Mine?
You don't have to do that. Don't worry.
Yeah, the overall CIP amount, I mean, it's estimated at 200.7 million right now,
Okay.
and it's funded through city capital dollars.
But then you say the total estimated cost of the project is $180 million.
That was fiscal year '22.
I think, Mark, that the estimates for what it's going to cost go up every year.
Please use the microphone.
Okay, I think the estimates, like many capital projects, it looks like the estimates for what it's going to cost go up every year. So, you know, they start out thinking, oh, it's going to be $160 million, and then the next year they're like, oh, whoops, no, it's going to be 180, and then the year after that, no, 200, right?
No, I understand that, but I see here, it starts off at 180 million, and now it's 160 million, so that can't be the case.
That was 2021. It was the 160.
Yeah, and the project's still ongoing.
If you start at the bottom of the paragraph
No,
and go
in fiscal 22, the
chronologically.
total
go-
estimated cost was $180 million.
You start with
Mr.
the
Kaplan,
160
what I'll do is I'll bring it back to my capital people and put together an analysis, and we'll give it to Katrina to give to you later on.
Okay.
Thank you.
I'm happy to give the rest of the scratches to you, where I think there are self-evident issues.
Are there any, if there's no other questions, I'd like to go to the management letter.
Yes, so we'll turn it over to Tammy from Grant
Can you
Thornton.
hear me? Oh, okay. Can you hear me? Is that better? Okay,
Yes.
great. Good morning, everybody. I'm
We
Tammy.
can hear you, it's more like for the IT.
Okay.
yeah.
Well, hopefully everyone
For
can
the
hear
people
me
in-
on Zoom or in
Yeah.
person. I'm Tammy Rudinsky. I'm the audit partner from Grant Thornton. And as David said, I have here with me today Steve Diaguardi, who's my senior manager. So happy to present to you the management letter. So the management letter, what we do every year, obviously we audit the financial statements, and you just heard a great analysis from management on that. But as we go through the audit process, if there are control findings that we identify as part of our audit process, we bring them to the attention if they weren't the attention of the committee. And as you asked, we've presented this already to the audit committee many months ago. So there's 3 levels or significance of levels of control findings. One is the material weakness, which is the highest level, the most harsh, I should say. Then there's a significant deficiency below that, and then a control finding. So during fiscal '23, we did identify one significant deficiency, and that relates to the internal controls over financial reporting, specifically related to grants, and within the grants, specifically related to the T2 grant program that was kind of discussed earlier. And our finding related to that the T2 grant program was not maintained or reconciled timely. It led to an immaterial overstatement of revenue in 2022 and recorded a reduction of revenue in 2023. And we also noted that the grant revenue initially recorded included budgeted versus actual expenditures. So our recommendation here is that management prepare a formal analysis of expenditures by the funding source and documented accordingly on a routine basis. and that it should be based on actual expenditures and not included budget expenditures. We also recommend that the scheduled expenditure of federal awards, and that's the schedule that's reported through the City of New York, where you record any and federal grants, be reconciled to the grant revenue reported within these financial statements on a timely basis, which will help improve oversight and ensure the financial statements accurately report grant revenue. So that's our finding during 2023.
And what's the status of the reconciliation?
So we've checked back with our T2 colleagues, and they are doing the reconciliation quarterly.
So in a sense, March would have been the third time that the reconciliation was done?
Correct.
And are there any significant differences on that reconciliation?
No.
Can you give the status of the negative receivables?
The credit balances? Credit balances, that's for management to update.
So our RCS area, they continue to make great strides in this area. We don't think it'll obviously ever be zero, given the complexity of billing operations. But I think, and we spoke about this internally with our own audit committee, where we do see the decline in this area, and we're hoping that at some point, particularly maybe perhaps this fiscal year when the new audit occurs, that this could actually be sunset as a finding that we continue to report on.
Because one of the things when I looked at this and on the bottom, I guess of the next to the last page, I didn't see anything where it was basically double billing. One where you got money back from an insurance carrier, but meanwhile the patient paid for it as a difference.
Right, a lot of oftentimes what you see, especially with rev cycle operations, is there's a discrepancy in the AR system when we bill it out and what we think the expected reimbursement will be. And when the reimbursement comes in the actual, there's a residual balance that remains, but that's really oftentimes due to what's set up in our system in the way of contracts and the appropriate expected reimbursement. And that's part of what, they've been trying to address, is really having the system reflect accurately the expected reimbursement when we bill out the AR and what comes back in, so that what comes back in leaves a zero balance and automatically. So that's a work in progress, but again, there's been a decline in this area, so we think that they're really getting their arms around this. There was a matter that occurred this fiscal year, which we're looking at. You'll probably hear more about it in our upcoming audit, but we had a disruption, you probably heard about it, with Change Healthcare, which is our clearinghouse, our billing clearinghouse. So that's kind of disrupted some of the information we get back from payers and our billing operations. So we have to see kind of what impact that's going to have to this particular area, because we depend on that information, comes into our files into our AR system. And oftentimes, if it's not correct, it would create these sorts of balances, the erroneous balances. So that's something we're working on as we speak, actually. But I'd expect that you'll probably hear more about it, when we conduct this year's audit.
So you're giving us a heads up for a management comment for this year.
But not so much a comment, but there's a lot of work in this area just by virtue of this issue we're experiencing, where we actually even had to transition to a different clearinghouse this fiscal year, Experian. And this is a national issue. You've probably kind of heard about in the news, where there was a issue with the Change Healthcare, where there was some hacking or something that occurred that disrupted their particular application. But fortunately for us, we were in line to having or transitioning our change from Change Healthcare to Experian. So our clearinghouse was in the process of being changed. We just accelerated it because of this issue. So, but we hope that there'll be minimal issues from that particular circumstance.
Thanks. Does anybody else have any questions or comments regarding the management letter?
I have a question.
Okay, go,
What-
Wes.
What if any, does this have any impact on the patients, or is this on a different billing cycle? This is, yeah, if you could just break that out, because I'm looking at the management letter and I'm looking at another paragraph regarding to the volume of these balances and manual processing of checks does slow the effort. Medicaid and Medicare credit balances remain low, and payer system not accepting voided claims, et cetera, like that. Yeah, if you could just break that up so I could just understand. I'm on the wrong document, apologies. But no, but if you could just break that down to why, if at any, has any impact on patients.
So we take great care in terms of when we bill patients. So, and we're, to be honest, we're, before we even go after a self-pay situation, we make sure that, we bill the insurances. So that's kind of why some of these things linger actually as a balance if it's in the self-pay category, but there's insurance present. The staff tend to really, double check and ensure that the insurance is not obligated to pay that balance before we go to, try to collect from a patient. So, I don't have a breakdown in front of me in terms of kind of where the balances lie right now that's being referred to, but as a system, we're very sensitive to that situation. We would never want to, inappropriately bill a patient for a copay or an encounter when they're not obligated to pay, because we want them to come to us to seek care, and we don't want them to be burdened by, erroneous payments and things of that nature and make, healthcare, unaffordable for them. So we have a lot of programs around that too and safeguards to ensure that we don't do that.
And in the event they can't pay, those safeguards prevent their credit history from being damaged.
Correct. We use a host of kind of early out AR vendors, to help us collect, but they are not, they don't have the ability to go after a patient's credit or anything like that.
Okay, then, thank you. But I must add a comment that I understand that the health industry overall is, especially in New York, is having a difficult time, not just on the state level, but on the state level, with getting reimbursements on the Medicare and Medicaid, and it's kind of strangling the system. So I hopefully we will come to some solution.
Yes. Yep, that's true.
Thank you.
Okay. If there's no other comments or questions, I'd like to thank you for coming this morning, and good luck.
Thank
And
you.
let's
Have a
hope
great day,
there's not a
everybody.
comment. Good morning, and welcome to the Audit Committee. This is, what we're going to hear is the report that was made by the controller to the mayor and the city council on audit operations. I'll turn it over to you, and for the record, could you please introduce the people that are here with you?
Sure. Good morning, committee chair and members. My name is Maura Hayes-Chafe. I am the Deputy Controller for Audit, and I'm joined here today by Peggy Horning, who is the Assistant Comptroller for Financial Audits, Edward Carey, who is the Assistant Comptroller for Management Audits, and Marianne Mullaney, who is the Executive Director for Special Audit Projects. Before I get into the bulk of the testimony, I really would like to acknowledge the contribution to New York City by Peggy Horning. She will be retiring at the end of June after 39 whopping years of service to the Audit Bureau. She started as a trainee back in 1985 and has climbed the ranks based on merit, and her contribution is well noted and very much appreciated.
Thank you very much. Thank you. I was never, I was
Peggy, I don't know if you heard me, but if anybody's talking, you have to keep on holding the push button down so that it could go onto the record. And at that time, it was called the Bureau of Municipal Investigation and Statistics.
I know you started before I did. You were here for a controller before my controller. I was here for, Harrison Golden was the first controller I worked for. You worked before that,
I go back to Procaccino.
right? I remember that too.
Okay, we got the history lessons out of the way.
Okay, so we are here to discuss the fiscal '23 audit operations. During that year, we issued 30 reports, which contain 96 recommendations for improvement. One of the measures that we use for whether or not audits are having a proper impact is looking at recommendations and their implementation rate. In fiscal year '23, at the time of the report, agencies had committed to implementing 58% and to partially implementing a further 11%. It's worth noting at that time that they disagreed with 23%, and if you compare that rate to the year before, you will find that the disagreement rate went up and the agreement rate came down. We're not entirely sure why that is the case, but in fiscal year '22, the agreement rate was 67% and the disagreement rate was 11%. It's hard to say why, but the one positive note is that I think we've mentioned before, but we began tracking recommendations on an ongoing basis from January 1, 2022. This is a departure from the prior administration, which took a once-and-done kind of approach. They reported in the annual report and then ceased tracking. We continue to track, and if you look at the tracking recommendations since the recommendations implementation since January 1, 22, you find that there's actually a very robust rate of agreement. As of today, when I looked this morning, 46% had already been implemented and 40% were still in process of being implemented, which means the agencies agreed to implement close to 86%. Why is there a difference between the report and actuality? We think it's because what happens is audit agencies often will say no in response to the report, but later down the track, they change their minds and agree to implement and quietly report it as done, right? So recommendations are self-reported, so we also conduct follow-up audits to look and see directly whether or not there has been improvement. During fiscal year '24, we conducted 4 follow-up audits, one of the COMB's enforcement of fines, one of DOB's controls over inspectors, one of DYCD's oversight over crisis shelters, and the last one over DCWP's enforcement of New York City's Earned Sick Time Act. In most cases, we found some measure of improvement, not 100% adherence, but the details are in the report. And I think it's worth mentioning in particular DCWP, which stands out as a remarkable case of improvement. There were 21 recommendations in the 2019 audit, and we found 19 of the 21 fully implemented, and only two, or the two that were not, we found no longer applicable. So that was a really good example of improvement based on audit. During fiscal year 23, we saw the issuance of several audits of COVID programs, most of which indicated some measure of waste and or a lack of appropriate controls. For example, we audited NICEM's oversight over Salisco, which was a vendor that was hired as a vaccination provider. We also audited DOH-MH's oversight over EMS, a provider that ran testing and vaccination sites. We conducted a review of DCAS's emergency procurements, and we also conducted SBS audits of COVID loan and grant programs. On the whole, as I said, there were needs for improvements. I think DOH-MH stands out as a particularly strong instance of waste. The bulk of the reimbursement provided for under that contract was based on staffing. And we found that DOH-MH did not control staffing levels sufficiently. So there were massive swings in the cost per head of a vaccination and a test conducted across the city because they didn't respond when volume of need fell. They did not reduce staffing. As a result of that audit, we issued a letter to all commissioners with best practices about what we recommended for greater cost controls, and that went citywide and was also reported across, it was publicized and reported. In SBS, we found that the bulk of the grants and loans went to businesses in Manhattan. And in general, I would say that we found the outer boroughs were underrepresented, largely because they did not promote the loan and COVID programs sufficiently and evenly across the boroughs. Yeah, and one last point about DOH-MH, just because, I don't know if you've noticed, but we have made an effort in recent years to, instead of just citing problems, also calling out agencies for things where they have done a good job. DOH-MH, for example, we did equity testing to see to what extent the test and vaccination sites were evenly spread across New York City in neighborhoods of color and neighborhoods where there was a pronounced need. And we did find that they did a particularly good job of that, and it is noted in the report. In terms of other initiatives during 23, I think one of the big ones is our push toward participatory auditing. We introduced a framework which we worked on collectively with the Canadian Audit and Accountability Foundation. And we developed a series of a way to look at audits from the standpoint of how can we increase community engagement. The theory is that if there is greater engagement in the audits, in the audit process, we can hopefully increase the leverage of audits and increase change. So the participatory framework imagines a spectrum in which maybe one or two elements of participation exist. For example, we consult with community groups as part of the audit observation objectives and scope setting. Or, for example, or sometimes in tandem with, we conduct surveys to assess end user satisfaction. And it's a valid way to go. I don't know if you would have seen our recent PFRED audit report, but that is a case where we found a high degree of satisfaction by the end user, which in that case was the food distributors, the folks who were receiving the shelf-stable food items that were purchased for distribution. And the audit testing, which showed overall very poor fiscal control by the agency, right? But it's a way to look at it from both perspectives. On the extreme end of the spectrum, you have participatory auditing, and we launched in 2022 a a very big project with NYCHA. NYCHA was chosen because there's a protracted problem there that is very much in the public domain, and a very large group of residents who are highly dissatisfied and who have very much lacked a voice in the process. So we set out in the summer of 2022 to canvass residents and ask their opinions, right? It included some education. This is what an audit can do. This is what an audit can't do. But what are your issues and what would you like to audit? We began 2 engagements which were completed during the fiscal year. As a result of that, one was the NYCHA doors audit, or rather it's not an audit, it's a set of observations. More than 100 of us took to the streets over 1 week, visited every single development in New York City, tested the doors to see whether they locked, whether locks worked. We looked at windows, are the windows broken? We found very troubling things that came out of the concern that was expressed pretty much across the board at all of the community events and in the surveys with security, right? If you can't lock your front door, you have a very fundamental type of security problem. The auditors observed, this was a follow-up. There had been an earlier one done, I think in 2018, and the results were markedly worse, which is troubling. We've been pleased to see that the City Council has responded to that. It took them a long time. We published the report in September of 22. In November of 23, there was a hearing held at which we testified. I think Marianne testified very capably about, and the subject of the hearing was security infrastructure, lights, locks, and doors at NYCHA, right? So we were pleased to see that impact. The other engagement that we started and completed in fiscal year 23 was a review of rent calculations at Red Hook houses. And that came about because when we went on site at that development and Feggy's team conducted that review, there were a lot of concerns about the way recertifications and the calculation of rents was conducted by NYCHA. We found, in fact, almost 20% of the rent certifications done at those 2 houses in the sample were inaccurate. In some cases, they were overstated. In some cases, they were understated. We also found that the system is entirely manual, really, pretty much. They're still collecting paper, and it is not centralized in any way. It's done development by development, which is kind of shocking when you look at where we are in 2024. We also started 2 audits that were based on a vote of a resident committee. We established a NYCHA resident audit committee. It's, I think, about 20 people. It's a diverse group representing all boroughs, lots of different age groups and ethnicities. And we sat down with them, and based on the survey results, we pitched 12 to 15 audit ideas that sat in the buckets that they had concerns about. Security, elevators, construction. There were a lot of recurring themes from that engagement. They voted on them. There were 2 rounds of voting, and in the end, they selected 2 audits, which are now underway. One was to look at the eviction rate at RAD-packed houses. Despite some reporting that suggests there's very little difference between general NYCHA and RAD-packed, there's a general suspicion amongst many of the residents that RAD-packed is really on the up and up. So we were asked to audit that, and that audit is nearing completion. We were also, the other audit that they voted for was to look at the oversight of vendors and contractors by NYCHA. So both are slated to end around July, and they will probably be released in August, along with probably the resident committee. But we've engaged with the resident committee throughout the process, keeping them up to speed with what's going on, consulting with them, asking them what do they think of our gut feeling or our review and our review results so far. It's been a very interesting process. I think in fiscal year 24, you will see, we're very excited about the work that is coming out. In this administration established strategic objectives for the Office of the Whole. in January of 2023. They are to increase equity inclusion, strengthen New York City fiscally, to improve effectiveness, to engage and educate the public, and to improve risk mitigation. And audit subjects are being selected based on that, and you will see a growing number coming out in the next, well, they've already come out in fiscal year '24 and will continue to come out that zero in on some of those issues. Okay? I think that's all I have to say in my testimony, but if you have questions, of course, we'd be more than happy to answer them.
Hi. So participatory auditing, so that's a fascinating approach. Now, so I just want to ask, so you did the audit on security in the locks, lights, et cetera. And so you did the audit, you gave it to NYCHA, right? What you found out. And do you, on a regular basis, then report back to the folks you spoke with on, well, yeah, now they've fixed 10% or 5% of the lock, or whatever it is?
We do not. One of the things that came out of this is that we found that what was reported by NYCHA and resident experience did not align. We reported, based on what was reported to us, that the recommendations were implemented. Residents in the committee, when we spoke to them of it, said, no, it's not true. Nothing has been done. And I suspect one of the reasons the city council went forward with testimony on this issue is that they could lean into it. So I believe there is ongoing reporting. You know, it's a difficult issue because it's not static. It's not a case of, okay, we can fix all doors that are not working. They have to continue to do it. We also found a problem not just with broken doors, but with residents propping open doors. Because there were other problems. The intercom systems that provide access to and from the building frequently don't work. Someone is expecting a visitor and they prop open the door because they know they're not going to be able to let anybody in. They won't know if a visitor has arrived, right? So it's a complicated problem. I think it's really great that it's in the public domain, but am I assured that it will lead to continuing improvement? Hard to say.
What do you think might improve continuing improvement?
I mean, the audit was very specific about it, but they need to have a continual program of maintenance. They need to continually inspect the doors, the intercom systems, the locks, and make sure that if they're broken, they're rapidly fixed. If they don't do that, it's not a once and done thing. It's a continual program of improvement. And I don't know if you guys want to add, you have far more experience collectively working with NYCHA than I do, but I think one of the problems is that NYCHA is not centralized from the standpoint of these programs. Each development has its own resident manager who is responsible for the maintenance on site at that development, and so you get a very patchy thing. Some residences are better served than others. You guys want to add?
Is that made public? That some residences get better maintenance than others? Is that
Yeah,
clear to the
the
public?
report highlighted the differences. So there was a chart in the report that shows by residence, by address, by building, what was fixed and what wasn't. I don't know if any of you remember, but there were certain that stood out as particularly poorly served.
Like, there was some of the things that you had said, especially about the doors, that they were broken and then fixed, then they were broken again. Is there a report, like, over a 6-month period of time, how many times they were fixed and then broken again?
Not by us, no. There may be something that NYCHA is doing. In fact, I could look and see what came out of the hearing and see whether there were commitments made. I haven't looked to see what the upshot was, but often when the committee finishes, there are local law amendments. And, this is a good thing. We've found that even where agencies refuse to make changes, sometimes city council steps in and mandates, and I don't know what's happened with NYCHA, but we were very pleased that they took it up because it usually leads to some kind of action. For example, in the sweeps audit, which is spoken of here, we found that the program was not effective. One, we also found that DSS did a very poor job of collecting data and publicizing it. And one of the things the audit report did was report on what other cities were reporting in publicly. DSS refused to implement the recommendations, said they were not going to track those things. But City Hall has since introduced a local law, which is pending, a bill that, if passed, would require DSS to report on precisely the kinds of things we asked them to, and they refused to. Yeah.
Based on also one of the audits for the Department of Health and Mental Health, is there a potential disallowance for the COVID grant? And I don't know all the details about the COVID grants and the funding and the reporting back, but on a citywide basis, because of what happened at Health and Mental Health, the potential for a disallowance based on that grant.
I don't think I think the Salisco audit recommended a recoupment of about $135,000. There is a further audit, which we have been unable to release because of pending litigation, which calls for a substantial recoupment. But in terms of what made its way into the report and what was reported in fiscal 23, there's not a large number of recoupment. One of the things that happened with the DOH-MH audit is that it would be impossible for us to go back retroactively and say you really only should have served this site with 2 nurses and instead you had 10. In practice, very difficult to quantify the overpayment. But we did find that there was a massive swing, as I said, in costs, which suggests it was wasteful and that they should have done a better job of ensuring staffing was commensurate with the level of demand. DOH-MH disagreed with us, of course, which is not uncommon. We shall see what happens in the next round as they go forward.
Is there anything that can be done by this committee to add to the kinds of pressures that I'm familiar with in the private sector? Because if an audit, internal audit department sends a report, for example, that no attention was paid to the determination, pretty darn soon the head of that department's up before the board for his or her own career. Is there anything we can do like that to help you?
I mean, I think it's, I think you asked this question, the same question last time I was here, and so I read your mandate, and it appears you have the authority to do what you agreed to do. So it would be up to you to decide, for example, if you wanted to call agencies to testify about certain things. I believe you could, if you all agreed to do so. We do rely very heavily on things like press to raise issues, which tends to create leverage. And we are seeing change as a result of that leverage, but it's not always acknowledged as directly related to the audit. So, for example, recently we issued a speed camera audit, and we found that there was over several years, a growth of over 5,000% in the number of ghost plates and obscured plates that were being used and circumventing the speed camera. So we estimated conservatively that the city was losing about $108 million a year in those missed fines. And about 2 weeks later, the governor and the mayor jointly announced a huge initiative to crack down on such plates. There was no mention of the audit. Of course, we took a victory lap of our own, because we see they're directly related. And in fact, it was a recommendation that New York City work with the folks who are responsible for toll collection, which is facing a very similar problem, and that they take action collectively to address the problems. So we're pleased to see it. Ferry audit was another one, which is in a prior year. But 2 weeks after the ferry audit was released, there was a change, again, quietly made, no reference to the audit, but there was a change in fare policy. So we are beginning to track those sorts of things, and we are seeing more of them, and we're very pleased with that.
In several of the audits, it said that the agencies, like as you pointed out, fines or fees weren't paid, and they say they're not going to go back. The funniest one was conflicts of interest,
Yeah.
which we kept on getting letters, you got to file, you got to file, you got to file. There's what, a $250 fine
Yes.
if you didn't file or something. And interesting to see that, like over $40,000, was in arrears, and they don't even know if they'll be able to collect it.
Yeah. It's one of those things that we come back to all of the time. We don't have the authority to force change. We note change, we ask for change. As I said, one of the positives is even if they tell us no way during the audit and in response to the audit, they will very often quietly go and implement, and it only shows up in that protracted tracking, which is public, by the way. We have the recommendations tracker up, so anybody can look and see what they've reported as implemented.
Yeah, no, it's the cell phone tower was another one where tall buildings sell the rights or rent for the major internet providers to put cells, and they don't collect the taxes.
Yeah.
I think for the cell tower, yes, we make the recommendations, again, as Maura said, and we say to them, there are tools that are out there that are available that will allow you to identify sources of potential additional revenue, and that they should use all the tools that are available, and coming from another city agency, from Department of Buildings. And so, again, we recommend that they use it, they use it consistently, and identify all the possible cell tower sites that are out there and make sure there's revenue reported for those sites.
Yeah, I think we got a partial agreement there.
I think they said they accept it, but they're not going retroactively to try to collect from those people that never paid.
Yeah, I mean, I will say, I have worked on the other side, right? Before I came to the comptroller's office, I ran the audit program at DCAS, and before that at DSS. And I think agencies are saying to us frequently, we don't have the resources to do what you're recommending. In some cases, I think it's a fair comment. In some cases, it is not. But in my experience, it comes very much down to the commissioner. So for example, when I worked at DSS, the commissioner was Stephen Banks, and even if the program head was not willing to make the change, he would often come to the party and say, no, you really do have to make that change. Please get it done. And I found it very different to DCAS. DCAS, the commissioner at that time, was quite prepared. She's a different commissioner now, but was quite prepared to leave it to the deputy commissioner to decide. And you will see that when we send you all of the reports as they're issued, and you will see that in the tone of responses. Sometimes agencies are you can see from the tone of the response that they're receptive to change, they're receptive and willing to go forward, and others practically spit at you and say very, very clearly, you're barking up the wrong tree. And I was still at DCAS when some of those responses were written, and I think there was a general, this office audited several of their COVID programs, and there was real resentment because DCAS felt they had worked tirelessly on procurement for New York City, and they felt that the audits just didn't recognize that effort. And I think that's a fair criticism on one level. On another, it doesn't absolve them from the need to make improvements. right? So we are, as I said, trying to ensure that we note successes as well as failures, and I try very hard, we try collectively as a team, try very hard not to use the word fail. I think in past reports, I can remember as an agency rep seeing fail, 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 fail all through the audit. Nothing like repeated use of the word fail to put up backs and say no, no, not doing anything. So it is a conversation. And we are trying to have that conversation with agencies and saying, if you can't do that, could you do this? You know, what else would come close to mitigating the risk? But honestly, some agencies, despite best efforts, are not willing to engage in that conversation. Some are. It's a real mixed bag.
Yeah, in one place, I remember reading, like, the playbook wasn't written. And I mean, if back over my lifetime, like, and think about all the things, whoever thought we'd live through a pandemic? And I could picture that comment across the board for everything. So one of the things is that playbook now being written based on a pandemic, such as, like, throw out the city's procurement policies? We got to get some things immediately. And I can see those decisions being made, but where are they and who authorizes them in the so-called playbook?
You know, that's really theoretically up to the mayor's administration to take care of that. I will say that when you begin seeing, if you've seen some of our recent reporting on asylum seeker programs, for example, it is very much like, here we go again. Almost as though we did not learn very much from the last emergency, and we find ourselves in the very same boat. And there's been a lot publicly written about that. Both, you know, for example, we published a review or an investigation, if you like, of the use of staffing contracts to staff shelters, right, to assist asylum seekers. There was no competition. There was a vast amount of difference in rates paid to predominantly for-profit vendors to provide services. And, you know, the Office of the Comptroller, which had originally issued an agreement to suspend the rules based on emergencies, subsequently withdrew the emergency authorization precisely because New York City was not doing a very good job. If you're interested in that, you could take a look at BCA's, our contract office. The Bureau of Contract Administration published a report on emergency procurements and noting the trends, noting some of the problems, and citing best practice for improvements going forward. But I think it is very much a fair point. What has New York City learned from COVID? And will it do a better job with the next emergency? Hard to say. Yeah.
Going back to participatory, I love it. I think it's a great idea. So, all right, so you meet with the residents in NYCHA, and they tell you what their needs are, and you then do an audit on that. Did you ever consider using those same folks, or maybe even the younger folks who are living there, to monitor what's happening and get the data back to you?
We haven't. You know, it's interesting. When we worked with the Canadian Foundation to develop the framework, and that was one of the things they recommended, for example. I think we could do something like that in observations, but we could not in a GAGIS audit because the evidence would be difficult for us to verify. Because we strive very much to ensure that even though we're considering opinions and we may report them, we are looking for verification in independent evidence that's verifiable to give legitimacy to that input. But, you know, the Canadians, for example, work with a lot of international groups, and in places like rural Africa, they rely very heavily on people in the field collecting pictures and so forth. I think with our GAGIS constraints, it would be difficult. But I do think, I want to just say, in terms of the participatory auditing, and it's part of a larger trend in the office, we are working collectively across the other bureaus. We are not working in a silo by ourselves. We work very much in tandem with the others. So you may have noticed a couple of audit reports went out jointly with the policy wrap because the audits are not able to recommend something that we didn't audit, right? But the policy team is able to do research and analysis, which then results in a solution that's recommended outside of the audit. So we've done that a couple of times. And I could see something like that happening with the Public Affairs Bureau, for example, where they're reporting problems. And we have a group called CAC, the Community Action Center, which routinely follows up on behalf of residents and of New York City, not just at NYCHA, to ask about particular problems as they're reported.
So you're saying you could have people in NYCHA, especially younger folks who would love to do this, I'm sure, go around and keep track, and then it couldn't be in the audit, but it could be in the policy.
Yeah, it could. Yeah, it absolutely could. We could also publish it as something like a review, but we would have to, I think even when we're doing a review or an investigation, it's being conducted by audit staff who are trained to conduct GAGAS audits. So there's a very strong interest in ensuring that all of the evidence we cite to is actually verifiable. So I think in a situation like that, we might take it, but we would feel compelled to go out ourselves and observe the condition as well before we reported it.
It's a great presentation. I have the same problem with several of them where, particularly, for example, the Department of Small Business Services, which have rejected everything. Is there nothing that we could do by saying to the Department of Small Business Services, we'd like you to come before the audit committee?
Again, I think technically based on your authority, you could do so. If you all agree to do so, I'm not acting as the city's lawyer, but I am a lawyer, and when I looked at the thing, it appears you could. There's a catch-all that says you can basically have authority to do what you all agreed to do, so you could certainly do so. And again, I think with SBS, even if they said no, I think you will find as they report implementation that some of the recommendations were actually taken into account as newer programs were launched, right? It's interesting, we get a real mixed bag, but sometimes the fight is there and yet they implement despite the fight. And part of me just feels that that's inherently the nature of the beast, right? We have the mayor and his administration, we have the comptroller who's like chief annoyer, saying do better here, and an inherent no, you're wrong, knee jerk. But over time, we do see, it's heartening to see that there is change.
Have you guys ever put out some set of recommendations on how to handle an emergency?
We have not. Like I said, the BCA recently issued an emergency procurement thing, and after DOHMH, we issued a letter to all commissioners indicating that this is how you need to control a cost-based contract, right? Well, in that case, it's staffing. But we are also planning in the next year to issue new directives on contract compliance. It's not particularly aimed at emergency contracts, but I think overall New York City, when you look at the volume of expenditure on contracts and vendors, we do not do a particularly strong job of controlling those fiscally. And partly that's, a lack of resources. There aren't enough staff dedicated to reviewing invoices, for example. And it's also partly a lack of knowledge, how to do it. A lot of agency staff who are charged with reviewing invoices simply don't know how to look for unauthorized subcontractors, to look for whether or not the cost has truly been substantiated. And you're going to see that again. We've got reports coming out that will highlight that issue again. So we're planning to issue a new directive that will target the operational stage of compliance. I think, many agencies have a lawyer at the helm of the ACO department, so there is at least an understanding of what they have to comply with for the procurement rules. But once the contract is in place and the staff themselves are just responsible for seeing the contract oversight, making sure that they're monitoring and whatnot, I think there's a general lack of how-to. As well as resource. So we are planning to fill that gap. And I'd be happy to send you the letter that was issued to all commissioners after the DOHMH letter. Okay, will do.
Does anybody else have any questions or comments?
No, I thought that was a really interesting presentation, and I appreciate the detail that you went into. It was very helpful.
Thank you.
No, I agree. Like, it was very informative, and the participatory is very interesting.
Yeah, I think it's interesting. I recently presented out at ALGA, the Association of Local Government Auditors, and there was a lot of interest in it. And I think it's part of a growing trend to ensure that auditors and city auditors are not operating in a silo, right? We need to understand what people's questions are. We need to try and respond to them by scoping the audit objectives and the questions that we want to answer in such a way that people really want to know what they want to know about.
Okay, thanks for coming, and very informative. Faggy, lots of luck. Ed, I guess you're up next. Faggy, it's a great club to join. If there's nothing else, thanks, and I'll see you, what is it, about 2 weeks? And Kat, that's a Zoom, right? First, do I have a motion to adjourn?
Move.
Thank you.
Mikhail, we can